some COVID updates, which is sort of par for the course these days, and to respond to some of the previous speakers' comments that called in. I appreciate that the emails and people taking the time to reach out. First, so in the order, we have a series of COVID topics. They include masking, testing, vaccinations, and data reporting. Those are the standing items. So let me just touch on each of those quickly. First, with masking, I had a call most recently today with Commissioner Riley, a DESE commissioner, and all the Massachusetts superintendents were on that call this afternoon. And so, as I mentioned previously about masking, and I know given all we heard already about the virus and where we are as a community, not surprisingly, the mask mandate still will continue and press forward. At last check, it was January 15th, mask mandate across the Commonwealth with opt-out opportunities for certain districts, depending on the status of COVID in those communities. We think that will be extended to some later date. We won't have any update on that until January. And even so, I think Framingham would have to seriously take a good hard look at our own numbers before we made such a decision locally to move away from any kind of masking requirement. That said, there is a possibility of doing that at some point in life. These masks do need to come off. And the one way to get there is through vaccinations, as the mayor's pointed out and others have stated. So that is continued to be a pressing need for our community, and I'll speak about that more in just a moment. So that's where we are with masking. Just a reminder to everybody, and I'd ask parents to have this discussion with your children about how to wear these things. I mean, we've been wearing them long enough now to know that. We see all kinds of variations. They usually come down but not below the nose, or they sit like a hammock below the chin. None of that is appropriate mask wearing. So the way I have mine on is a good example, and pretty much everybody in this room is a good example of how to wear a mask. So please do that. Our teachers are nonstop reminding students every day. It's like just, it's a nagging. So just help us out. Put the mask on, wear it correctly, and that will be the first step. I also want to just frame this conversation and the updates by saying, I think we should think about this way we did it first coming into the pandemic. We should start with an assumption that everyone is an asymptomatic carrier and behave that way. To the extent that we can distance from one another or avoid handshaking and find alternatives to greetings, waving, or whatever it may be, washing hands frequently, the things that we learned, the basic essentials, let's get back to that and make sure we're taking good care of ourselves, because this leads into the sort of the testing piece and the contact tracing and things that have come up as a major concern for some. And then I'll make sure I get into the conversations around, well, what if cases worsen and is school going to close? And what about January and all those things that are on people's minds? So I'll try to get to all those topics too. With respect to testing, so we still have done a very, I think as a city, a good solid effort around pooled testing. Many districts have moved away from pooled testing. We continue to offer that, although it's imperfect. We're doing the best we can with the resources that we have. Continue to call in more support, as you know, with the National Guard being among those assistants. The test and stay protocol, on the call with the commissioner today, I did raise the question myself about whether or not we could have an allowance for testing, a test and stay protocol for vaccinated individuals, and the answer continues to be no. So that said, though, the state will reevaluate that, and sort of as cases likely will increase in the new year, after the holidays, they may reevaluate that. But at this time, and that funding, by the way, we're waiting on a number from the DESE, because the DESE, the Department of Elementary Secondary Education, the DESE or DESE, is offsetting all of those testing costs right now. If we were to not comply with that, those costs would be borne by the districts. And so that means that we would have to reduce our operating budget, which is already accounted for, to account for that additional testing, if that's even assume we had the staffing to do that. So we have a resource allocation concern, as was mentioned last time, but that's where we are with testing. I did make the reach on the topic about whether or not we could actually use the DESE allocation to test vaccinated individuals in the test and stay protocol, and that answer continues to be no. So just to be clear on that. With respect to vaccinations, our rates for among staff have improved, by 27% since December 1st. So we're about 86% staff vaccination, but we want to do better than that. We'd like to get us higher, and points have been made by previous speakers, finding ways to incentivize that, something that we are certainly looking into as an administration and school committee as well. So we'll continue to see about ways we can try to find incentives to do this. And also for our students, this is another call. And again, just to echo comments that have been made earlier, our numbers at the high school right now, high school student population, so all of our students are eligible for the vaccine. We're about 66% fully vaccinated. which is low. Districts around us, people will say, well, look at Hopkinton, they're without masks or it's optional, and look how well they're doing. Why can't we be like them? Okay, let's be like them. Let's get the 95% vaccination rate, and then we'll be like them. So if we're at 95%, we can talk about mask options when that time comes by the state. But right now it's 66% at the high school and 86% among staff. Not going to happen. At the middle level, we're looking at rates anywhere from 40% to 60% of student population at our middle schools in terms of vaccination. And at the elementary level, obviously much lower for the fully vaccinated students, as this is obviously one of the newer rollouts for the vaccines. But we need to continue to press this. We'll look to find ways. I know a previous speaker commented about hosting a vaccine clinic at the schools. We've done that. We'll continue to do that, working very closely with Alex DePaulo, City's Department of Public Health. We'll continue to offer those clinics. But it seems to me, with the availability of the vaccine now where we are for this long, and our numbers still being as low as they are in terms of participation, it suggests to me people aren't interested because it's available. And when we have these clinics and people don't come, or we put out opportunities to get there and they're not, I wonder why. So I would just put this other call to action that until we can do this, this is another safeguard: the mask wearing, the hand washing, physical distancing, all the things we know. Couple that with vaccinations, and we have a better shot at not having these cases. The question comes to me: why is there case spread happening in our schools? Well, I don't know. I'm not really sure. We have 6 hours a day with our children, and the other 18, I don't know where they are or what they're doing or what the behaviors are. So if we don't, as a community, pay attention to the entire 24 hours of the day and how we're behaving in those hours in school or outside, we don't have a shot at making this better. And by the way, we are not able to close schools. Let me just talk about that for a minute. We have a 180 school day requirement. There is no virtual learning or remote learning option right now. And part of the reason for that is a federal compliance with students on IEPs. If we move to a remote environment, students cannot access services to which they're entitled. That's one of the many complications. Forget about the fact that for some families, working remotely is not a problem. For other families, working remotely isn't an option. If your job is to get paid when you show up at work and you can't show up at work because you're home caring for your 5-year-old, you don't get paid, you can't make ends meet, you may lose your house. That's a challenge. So we're paying attention to a lot of factors. And I know when people will look at this, they're gonna look at the lens of their child, their family, their impact. And I respect that. But in my job, looking at 10,000 students, I'm looking at a much grander 30,000 foot view of this. And I see this as a problem that we actually could solve if everyone committed to it. So that's a call to action for everybody. I'm not sure how I can incentivize that. And, you talk about mandates. One of the suggestions of someone who's emailed me, and if I haven't gotten back to the emails, I promise you that I will. I've been a little bit inundated with them. The mandate for staffing in districts that have done this, and when we're at 86%, I think we can incentivize this to get to a higher threshold. But when you start to mandate and staff, with the job market being the way it is, basically jobs available everywhere and employees available nowhere, there's a lot of incentive to leave when mandates happen. And that will create a different problem for us. That will create a staffing shortage of staff that will migrate out. In fact, we've been able to hire staff from districts that have terminated their employees because they were mandated to be vaccinated. So now they're into a testing regimen, right? So we're in this interesting cycle that's complicated. The comment about substitutes. And having, it was made by a previous speaker about, so we have an assigned cadre, if you will, of substitutes that cover classes that are dedicated to schools. And we ask our principals to review the staff roster each day to see where substitutes are essential and where substitutes may not be essential. So let me comment on that for a minute. Substitutes may not always be available. And by the way, they're really not. If they were, we would be hiring them. So our challenge is that we're putting kids in large mass settings to the extent we can, in cafeterias, so that's where we can distance, or in auditoriums. That is not ideal education. We're seeing cases, in some cases, of staff absences in the hundreds in a day. So the scope of this is magnificent. And the challenge is getting worse. And I suspect it will worsen over the holidays, and we're not able to shut schools down. So we have a real challenge with this one. If we were to close a classroom and we were to close a school, we'd have to make those days up at the end of the school year. So let's say you had a situation where school X was seeing an increase of cases, and to the outsider view of that would be, well, let's close the school down, let's do a reset, everybody gets healthier, we come back to school. There's logic in that, except that that particular school and only that school has to make up those school days in June. So we're now running the fleet of school buses. We're having the teachers come, and make up all those days because we can't instruct remotely during that time of quarantine. So we have that challenge also in front of us. So I wanted to just illustrate some of these challenges that are in front of us. And finally, in response to I gave out the data reporting already, but the last response here on the COVID topic is around the notifications with close contacts. This is another challenge for us because there seems to be a mindset of, well, I'm better off not telling the district if my child's vaccinated or not, because if they're unvaccinated, then I can get a phone call about my child being a close contact. I mean, I actually get that. Practically, that's not going to help us because we don't have a dedicated staff of 500 people to make contact tracing, and it requires a level of skill and expertise to make these phone calls. So you have the public health nurses that are involved. All of our school nurses, when they're doing school nurse stuff during the day, which they're really not getting to because the time is spent contact tracing, that's an additional challenge and a demand because the contact tracing is time consuming. It requires phone calls and more phone calls and follow-ups. This has been raised before. So one effort that we've made, I think, to try to help this, to mitigate this to some extent, is to provide a notification to families when there is a classroom incident of positivity. So let's just pick a classroom. Room X has a student that's been identified as being positive through a pool, and we would only notify the close contacts of those students prior. Now we're going to send out a notification to the entire classroom saying that a child in this class has tested positive. Now, it may not necessarily be that you're a close contact, because if you are a close contact, we're going to notify you. It may take time, and we know that's a regrettable lag, but someone will contact you if you are a close contact, especially if you're unvaccinated, because you're the most vulnerable. But at least by creating an awareness of the classroom, I think this was raised at the last meeting, that we can have a better shot at making sure that everybody has that ability, at least, and I think this gets to a previous speaker's comment, take greater caution. So if a child's at home and they have a sore throat, and you had a notice from the school that said there was an exposure, even if you're not a close contact, you might measure that sore throat differently and say, well, it could just be seasonal cold, but it might be something more. I'm probably better off to be at home today and get a homework packet or reach out to the school and make sure I'm okay and take care of my child's health at home and not send them to school waiting on contact tracing to be the solution. So we think this will be a step in the right direction. I need to put a big old caution on this one though. So here it is. That might mean multiple notifications many times in the same day, or if you have multiple children, and we're trying to do this in a mail merge way so that if you have, child A, B, and C, and you get a letter that's a form letter saying your child was exposed today in his class or her class, that you know which child it is. And if you're at a high school and those classes change, if you're thinking, if your lens is elementary and you're in room X, well, that's simpler. But if your child is at the high school and they're moving to 7 different classes in a day, you can imagine the complexity of that communication. So we are working on this in our technology, and I'm laughing because I don't know how she does it. Ann Mariano is writing code to try to do this in a way that can merge those letters so that the duplicates are eliminated. So we don't have multiple letters going to families. So we don't want to raise an alarm saying, I got 7 letters today. What's going on at that school? Well, it might mean that your child was in 7 different locations. And so we're notifying you in an abundance of caution. So the takeaway here is, let me just recap all of this. The takeaway is treat every situation like you are and everyone around you is an asymptomatic carrier of COVID-19. If you do that, you're going to move in a certain way and behave in a certain way that's different than if you assume everybody's vaccinated. And then from there, trust that we will do the best we can to notify families. We've hired additional staffing, our own staffing, to pay overtime to help with contact tracing. And we've enlisted now a third-party vendor who specializes who's skilled in the contact tracing process. We signed them on with us as well. So we're taking a lot of steps to improve the contact tracing. This notification is one additional step. And obviously self-awareness. People are going to be traveling. People will be seeing family maybe in a long time. They haven't seen each other. Take precautions. If you're not feeling well, stay home. We'll work out the absences. We'll deal with that. And if things change from what the state will provide for us to move to remote or allow us, depending on what happens with our cases, hopefully you'll hear it from me first. I'll be sure to let you know. But we are watching this very closely. We care deeply about this. And we should also just, even though we have cases and it can seem like it's, everywhere and worse than ever, and some of it's not great, we're in school. Our kids are seeing each other in person. We're enjoying activities together, some of our sports, although we've had to close some of those, concerts and things in safe ways. And we're seeing all the losses over the last 18 months, 2 years. In some way, there's some level of healing in the midst of all this. So I wanted to just give some context to this and not be sort of doom and gloom, but to give you an honest reporting of where things stand. And really just to understand, just an ask for some empathy here. We're doing the best we can. We really do care, and everybody's working around the clock to make sure that our kids and our staff are safe. I don't know how else to communicate that except for you to just believe me on that. So those are my remarks on the COVID-19 update. Mr. Chairman, I apologize for going on my soapbox with this one, but I wanted to give you everything that was knowledge that I was aware of tonight to the committee and to the public.